My name is Cristina Sanchez and I work at Complutense University, and I've been working for the last 15 years on the potential anti-tumor effect of cannabinoids.
15 years?
Almost.
Yeah, that's roughly about the time Buzz Buddies, our organisation, have been going as well, so we started about the same time. That's good. So, can you tell us a little bit about your work?
Okay. Well, I've been working on the anti-tumor potential of cannabinoids from the last 15 years. At the beginning I started to work on glioblastomas, brain tumors, but since almost 10 years ago I decided to move into another type of tumor that is very common, which is breast cancer. And our group has been working very hard on this topic, and we have preclinical evidence showing that these compounds, THC and especially CBD in the case of breast cancer, could be used in the therapy for management of breast cancer as well.
That's very interesting. In treating breast cancer from your research, most of the evidence I've seen, or anecdotal evidence on the internet, is high THC. It's interesting you mentioned CBD. What's the importance of CBD in treating breast cancer?
Well, in our hands it was pretty obvious, and I want to insist that we work in animal models of cancer, not in patients. We have seen that CBD works even better than THC, which is actually very good news because, as you know, CBD doesn't have psychoactive properties, so it should be easier to get to the clinics with this compound. So, as I said, in our hands, CBD reduces tumor growth as efficiently as THC, and not only tumor growth but tumor angiogenesis, the generation of blood vessels to feed the growing tumor masses, and also the metastatic process, which is the one that eventually causes most of the breast cancer associated deaths.
That's very interesting. And where do you source your pure CBD oils at the moment?
Well, we work with two kinds of CBD. We work with pure CBD, which we obtain from Rafi Meshulam group, originally sent us some CBD, pure CBD. And more recently we use compounds from GW, plant extracts enriched in CBD.
Okay. What sort of percentages of CBD are they? These liquids? Is it pure CBD, like 99.9%?
Yeah.
Or
when we use pure CBD, we are supposed to be using more than 99% pure CBD. And when we use plant extracts, we use something that is enriched up to 70% of the whole extract.
And which is more effective, the 70% whole plant extract or the pure CBD?
It depends on the setting you are considering. If we work in cell cultures, the pure compounds work better. But if we work in animal models of cancer, the extracts seem to work better than the pure compounds. So probably there is something in the plant that we are obtaining within the extract that is helping CBD to perform their anti-tumoral actions.
So the next stage is obviously take that up to people and see if the same thing happens.
Yeah, absolutely. I mean, that's the next step. We think that the preclinical evidence we have so far is solid enough and strong enough to move to the next step, which is the clinical trial. And we are trying to find people supporting this trial. We have oncologists in Spain that are willing to test these compounds in patients, but we need the economical resources.
Yes.
These clinical trials are extremely expensive, and we need the economical support to perform them. The doctors are with us, the preclinical data is with us, but we need to move forward and take the next step.